Hello.
Hi.
And what is your name?
DB.
TB, nice to meet you. I'm Debbie, and I'm going to be your nurse today to do a head-to-toe assessment for you.
Okay.
Before we get started, though, I do need to tell you that we are going to be videoing the whole process, and that I will need to get your authorization stating that you agree to having this video made and viewed by my instructors.
Sure.
Okay.
I agree.
You agree. Okay, very good. Then I'm going to go ahead and get my hands washed here. So do you have anything you need to tell me about or anything that you're concerned about at this point?
I don't think so.
Okay. I'm going to go ahead and ask a few questions of you too, if I may. Do you smoke?
No, ma'am.
Good. Do you drink?
No, ma'am. Occasionally.
Occasionally, okay. How often is occasionally? Once a week, once a month, or once a day?
Probably once a month.
Okay. Okay. Now some quick questions here for you. Can you tell me your age?
I'm 43.
Okay. And your date of birth?
6/19 of 70.
70. Okay. Do you work outside the home?
Yes, ma'am.
You do. And what would that occupation and profession be?
I'm an RN.
Just a nurse. Very good. Okay. Do you have any health issues that I need to be aware of before we get started? Any surgeries?
I have had right breast cancer in 2010, so I had a lumpectomy, and I have fractured my ankle this past year, my right ankle, in August of 2013.
All right, based on my assessment so far, you do appear to be at your proper age, and your level of consciousness is alert and awake and oriented, ×3. Can I look at your hands for a moment, please? Okay. Your cap refill is fast, okay, less than 3 seconds. Okay, your nails look clean, well groomed. Okay. Can you fold your hands down and up? Okay, very good. All right, I'm going to be taking your radial pulse at this point. Okay, I'd say that's at a 2+. Skin is warm to touch.
Feels good.
Okay. Have you had any head injuries of any sort?
No.
No. Okay. When I'm doing this, if at any time you feel any pain, please let me know. If there's any tenderness, please let me know also. Check your ears here real quick. Is there any pain in that?
No.
Okay. And your trachea, any pain when I press on that?
No.
Okay. Okay, how about your frontal sinuses?
No.
No pain? Your maxillary sinuses here?
No.
All right. Okay, I'm noticing the symmetry of your face, your eyebrows, your hair distribution. Everything looks good here at this point. I'm seeing a straight nose, no problems with that. Your lips are pink, a little dry at the moment, however.
I'm thirsty.
You're thirsty. I can relate. Okay, I'm feeling for the lymph nodes. I'm feeling the subax. Any pain?
No, ma'am.
Keep raising your head like I'm hurting. No? Okay. Checking lymph nodes here. Okay. All right, I'm noticing that your skin color looks fair and smooth, even. I don't see any kind of rashes. Your nutritional status. How is your eating habits at home?
I eat well, I eat healthy. I have been doing shakes maybe about 3 to 4 weeks now with fruit and veggies and lots of water.
Okay.
I'm trying to eat 1 healthy meal a day.
All right. I'm noticing that your posture is erect and you seem to be quite comfortable in this procedure. I do not see any kind of deformities. Do you have any sort of deformities that you would like to tell me of?
No, ma'am.
Okay. At this point, I see none. I noticed when you walked in that you were not using any sort of assistive devices such as canes, wheelchairs, walkers.
No, ma'am.
Okay. So your gait was well. It was very voluntary. There was no involuntary movement of your arms or anything. Your facial expression is appropriate. You make good eye contact with me. That's good. How do you feel about your life right now? Are you comfortable in your life?
Pretty good. I'm very content.
Very content,
Mhm.
okay. Okay, your speech is very clear. You speak English. I assume that's your home language also?
Yes, ma'am.
Okay. All right. You're clear and you're understandable, and you speak at a moderate, soft pace. So let's go ahead and I'm going to do what we call a whisper test.
Okay.
Okay? What I need you to do is I need you to just kind of press on your trigger right there. And I'm going to say something to your other ear.
Okay.
Okay? You tell me what I say.
Baseball. Balloon.
Okay? The other ear, do the same thing.
Monday. Friday.
Very good. Okay? Okay, for your personal hygiene, your hair is clean and shiny, very shiny. You use a good shampoo and conditioner. Your skin is clean. I smell no odors on your body. And I'm going to be checking your mouth for halitosis. I'm going to ask you for what your weight is because I don't have a scale here.
165.
Okay, and your height?
5'4".
Okay. And since I have a caliper here, I'm going to go ahead and check this by grasping the back of your arm. Just relax your arm. There you go. Scratch it.
No.
Okay. 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 I did your radial pulse. Okay. Let's do your radials once more. Get my watch turned around. Likes to roll on me. It took a little longer on that one, but that was because I was giving you respirations at the same time. Okay? And I'm giving you a 2+ on your pulse rate and rhythm. It was approximately 65. Your respirations were 14. Do you by chance wear contacts or glasses?
No.
Okay, no visual aids. How about hearing aids? Do you have a hearing aid?
No.
I'm not gonna take your blood pressure in your right arm because of your lumpectomy.
Okay.
Okay, what is your blood pressure normally? Do you know that number?
Usually it's about 100/50 or 60.
Okay,
I run low.
well, today I got it at 98/70, and that's in a sitting position. Okay.
Mm-hmm.
Do you have any anxiety at this point in your day?
No, ma'am.
That's good. Well, we're gonna go ahead and take your temperature. Can you place that under your tongue and hold it there for me? And while I'm waiting on that, I know it's gonna be hard for you to answer, but maybe you could just shake your head or point a finger. Are you in any pain? Slight?
Mm-hmm.
Okay, on a scale of 0 being nothing, of course, and 10 being the most excruciating pain, what would you say that pain is at? A 1, okay? Can you point to the area that's causing the pain? Okay, your right ankle,
Mm-hmm.
and that's where you had your injury before?
Mm-hmm.
Okay. Does it hurt constantly, or is it every once in a while?
Mm-hmm.
Okay. Does something in particular bring on the pain? Walking. Okay. And what do you do to relieve it? Rest?
Mm-hmm.
Okay. Okay. .5. Okay, if you'll go ahead and close your eyes, I'm just going to put some cotton on your skin somewhere. Tell me when you feel it and where, if you would.
Forehead, cheek,
Which cheek, left
the
or right?
left
Okay.
cheek, right cheek, nose, left elbow, right hand.
Okay, very good. Okay, I'm gonna grab you around the neck here for just a second. I'm gonna check your trigger. Okay, you seem well hydrated. Skin went right back into where it was. You're not sweating. Your skin is nice and firm. And I see no lesions. Okay, now we're going to check your cranial nerve 7 by asking you to smile. Can you frown? Puff up your cheeks. Close your eyes real tight. Okay, very good. No problem with your cranial 7. Okay, now we're going to check your visual field, which is your cranial nerve 2. And where is it? just going to bring it in from the side and see how your eye reacts. Okay, other side. Okay. All right, now I'm going to come in looking at it straight on, all right? I think I'm going to try to get rid of those two. Okay? Okay. All right?
Mhm.
All right, very good. Okay, your light was reactive. All right, I'm going to go ahead and check your cranial nerve 3, 4, and 6. And what I'm going to ask you to do is follow my pen. Do not move your head, but just use your eyes, okay? Okay, very good. Now I'm going to bring it in towards your nose. Very good. Okay? I'm going to check your sclera and your conjunctiva. All right, very good. Your pupils were round, regular, equal. Reactive to light. Okay. All right, now I'm going to check your nose while it's right here in front of me. Okay, I'm noticing its midline. And I'm not seeing any problems there, no septum leaning one way or the other. I'm going to go ahead and check your ears at this point. I'm pulling your auricle up and back as I'm looking into the canal. Looking. Your ears are clean, that's nice. Okay. And again, this one is also very clean. Very good. Your tympanic membrane was shiny and translucent. On your left ear, I could see the cone-shaped light reflecting off at the 7 o'clock position. And on your right ear, approximately on the 5 o'clock, which is where they should be. All right, we've done the whisper test, and now we're going to do the Weber test. What that is I'm going to hit this tuning fork. I'm going to place it on top of your skull here, and you should feel a vibration. You should be able to hear some vibrating sounds. When you stop feeling it on your head, let me know. I'm going to bring it down close to your ear, and you'll still be able to hear the vibration, okay? And tell me when that stops again.
I don't feel it. It stopped. I can still hear it.
Tell me when it stops.
It stopped.
Okay. All right, that's on the one side. The next one we're going to do is called the Rhine test. And when I put that on the top of your head, were you hearing it in both ears?
Barely, if anything.
Barely, if anything, okay. Well, what I'm gonna do now is I'm gonna test both ears. I'm gonna put the end of this behind your ear on the mandible, and you should feel the vibration there. And when you stop feeling it, again, we'll bring it forward, okay?
It's done. Still.
Already? Okay.
I can still hear it. It stopped.
Okay. And on the other ear now.
It's stopping. I can still hear it.
Tell me when it stops.
It's stopping.
Okay. Okay, as I mentioned, that was the Viber, or the Viber, and the Rhine test. Okay. As I mentioned, I already looked at your lips, and they seemed pink. They don't look overly dry. There's a little bit of cracking, but you mentioned that you were already dry mouth. So we're going to do the mouth looking internally of your mouth, okay? Right. If it works. I don't know why it doesn't want to work, but there. Okay. Open your mouth, please. Nice and wide. Okay, there are no tonsils. You apparently had a tonsillectomy. Stick your tongue out for me. Okay. All right. Open again and put the tongue on the roof of your mouth. There you go. Okay, the uvula was in view. Your frenulum is right there. Stick your tongue